Chapter 10 will cover bloodborne pathogens and universal precautions. Bloodborne pathogens, or BPPs, are disease-causing microorganisms that can be potentially transmitted through contact with blood. Those pathogens can cause serious or fatal infections. The most serious include HIV, HBV, and HCV. BPPs are transferred through unprotected sexual contact, direct contact with infected blood or blood components through the use of needles, and contamination of open wounds or mucous membranes infected by blood. Due to potential exposure from patients infected with BPP, healthcare providers are considered an at-risk group. Dealing with wounds and potential needle sticks are common exposure mechanisms in healthcare settings. Given this risk, understanding the nature of these viruses and the need for adherence to standard precautions is imperative for practicing athletic trainers and is one of the key elements for any student entering a clinical learning environment. Human immunodeficiency virus, or HIV, is a progressive disease leading to immune suppression and the development of AIDS. AIDS, or acquired immunodeficiency syndrome, is characterized by the development of opportunistic infections and malignancies that ultimately lead to the death of the patient. It is associated with Kaposi sarcoma, a cancer of the soft tissues that causes highly visible purplish lesions and is extremely rare among those with normal immunity. Upon infection, HIV infects the lymph nodes, which may enlarge in a similar fashion to a mononucleosis infection. About 2 to 4 weeks after exposure, 50% of all newly infected people experience fever, chills, headache, and a sore throat similar to flu-like symptoms. Half of all newly infected people experience no symptoms. Both symptoms will enter in an asymptomatic stage that may be protracted months to several years. This period of time may present issue for healthcare providers regarding a patient's involvement in athletics. HIV specifically targets the lymphocytes, which are a type of white blood cell that are critical for immunity to fight viral, fungal, and certain bacterial infections. In the AIDS stage of the disease, the immune system is severely compromised and the body loses its ability to fight disease. There are estimated to be over 1 million carriers of hepatitis B, or HBV, in the United States. HBV causes infection of the liver and can make individuals very ill with fever, chills, loss of appetite, nausea, abdominal pain, jaundice, or any combination of these symptoms. Of the 3 viruses discussed in this chapter, HBV is the most contagious, but it is not the most virulent. Infected individuals may have no symptoms or only experience mild symptoms similar to the flu. About half of all infected patients have subclinical HBV, which means the infection does not make them ill. There are 2 major problems associated with HBV infections. The first is in about 6 to 10% of affected adults, the virus remains in the liver and bloodstream because the immune system cannot kill the virus. These individuals become carriers of the virus. Their bodily fluids can infect other people at any time. There is an estimated 400 million carriers of HBV. The second is that more than 78,000 people die every year due to complications of hepatitis B, including cirrhosis of the liver and cancer. Prior to its discovery in 1989 and the development of effective testing methods to detect the virus in blood products, millions of people were infected with hepatitis C, or HCV. Tainted blood transfusions, or blood products, accounted for millions of infections. Today, developed countries screen for such infections, and this is no longer a risk factor for infection. Most of the HCV-positive patients in the United States contracted the disease prior to 1990. Initial symptoms of HCV include diminished appetite, fever, muscle aches, fatigue, and sometimes jaundice. A large majority of people have no symptoms at first. Approximately 80 to 85% of cases are chronically infected for the rest of their lives. Approximately 6 to 12% develop cirrhosis of the liver within about 20 years, and as many as 12 out of 100 develop cirrhosis within 40 years of infection. HCV is spread throughout blood transfusions and needle sharing among intravenous drug users. Like all BPP, avoidance of high-risk behaviors and adherence to standard precautions is the first line of defense. While the risk of HIV transmission in sports is not considered to be zero, it is so sufficiently small that it cannot be accurately quantified. Transmission of HIV in sports has not been documented. Despite this low risk, some sports such as boxing, wrestling, and contact sports where bleeding is a possibility require vigilant use of standard precautions. HIV cannot be transmitted through normal body contact such as touching and sharing of sports equipment, though equipment sharing should be strongly discouraged, or use facilities such as locker rooms or bathrooms. The risk of transmission of HBV in sports is also considered quite low. However, it may be assumed to be higher than HIV given the number of potential carriers. HBV is resistant to drying, ambient temperatures, simple detergents, and alcohol, and can be stable on environmental surfaces for at least 7 days. Therefore, transmission can occur via environmental surfaces. HCV transmission is not as contagious as HBV and not as virulent as HIV. While it is a serious threat, it is not likely to be seen among participants on sports teams in developed nations. Again, the practice of standard precautions and avoidance of high-risk activities is the cornerstone to all prevention programs. Blood-borne infections can be transmitted through blood doping, and there is a significant risk of infection from sharing needles that may be associated with drug abuse in sports. Previous cases of HIV transmission among bodybuilders sharing needles for steroid injections have been reported in the literature. BBP can be transmitted through sexual activity. Having unprotected homosexual sex with men and multiple sex partners are the most significant risk factors for these types of infections. However, the most common method of transmission of HBV during adulthood is heterosexual contact with an infected individual, followed by injected drug use and then homosexual activity. Athletic trainers must be prepared to provide sound advice and serve as an educational role when fielding questions regarding these practices. The main methods of transmission of BBP are not through athletic activity. Potential infections for athletes are similar to those in general population. Educational efforts should focus on these high-risk activities that are unrelated to sport. In certain environments, the athletic trainer will be called on to serve as an educator. Athletic trainers can create and distribute information to athletes and patients, coworkers, families, and communities concerning the risk of blood-borne infections, availability of HIV testing, HBV testing and vaccine, and other questions that may arise in their employment setting. Dealing with patients infected with blood-borne disease requires special attention to medical confidentiality. The identity of the individuals infected must remain confidential. Only those persons with whom the patient chooses to confide in have the right to know about the medical issues. The level of confidentiality and security of records should always be afforded to patients with any illness or injury. Athletic training students must know the proper procedures to follow if they feel they have had a potential BBP exposure incident. An exposure means a specific eye, mucous membrane, non-intact skin, or non-oral contact with blood or other potentially infected material, or OPIM. As part of an accredited athletic training education program, students must be instructed in the reporting protocol for the various clinical settings in which they will be learning. Individuals will be designated to gather information and provide instructions for follow-up care should a student have a potential incident. While notification and procedures will vary by institution, the outline on page 244 in your textbook provides common steps to follow if there is a potential exposure. Additionally, on page 244, Table 10-3 has the procedures for care of environmental surfaces when cleaning after a potential BBP exposure. In summary, skin injuries and the potential for exposure to BBP are common in the sports medicine setting. This chapter provided an overview of BBP, considerations for athletes and care providers, appropriate management of athletic health care settings, and importance of an exposure control plan and the use of standard precautions. As a healthcare provider who is often the first responder to injury, the athletic trainer must set an example for proper use of standard precautions and serve as an educator to dispel myths and provide factual information concerning BBP.